oral questions put by members to ministers. The Honourable Leader of the Official Opposition.
Thank you very much, Mr. Speaker. Last week, the Premier and the Minister of Finance announced that after a windfall from an offshore royalties dispute, there would be significant unbudgeted spending in the dying days of the fiscal year. This spending was approved without the scrutiny or approval of the Legislative Assembly. Once upon a time, though, when this Premier was the leader of the third party, a future Minister of Finance introduced a bill that would have prohibited this type of manoeuvre. Specifically, it would have required that any sum supplemental to those approved in the budget must be referred to the House for debate. I know this bill was a few years ago, but could the Premier explain his change of heart and why he now feels that bringing supplemental spending to this House is not necessary?
The Honourable Premier.
Thank you, Mr. Speaker. I want to thank the Honourable Member for the question. I want to thank all Nova Scotians for giving us an opportunity at a second majority government in the province of Nova Scotia. I want to continue to thank them for showing the confidence in our government. I want to thank those public servants who, over successive governments, continue to work hard on behalf of our province to make sure that we were treated fairly when it came to the offshore revenue. That revenue came in, Mr. Speaker, and we identified what were serious priorities. Members from the opposite have continued to ask us about high-speed internet. We're very proud of the fact that we have the trust that will be spent over a number of years that will leverage both federal and private sector money to actually deal with the very issue that has been here for far too long. The issues that we've vested, many of them have asked us about more healthcare providers treating doctors more fairly, Mr. Speaker. Part of that money was used for that, Mr. Speaker. We've had lots of debate in this House about these issues, and we listen to you.
The Honourable Leader of the Official Opposition.
As the old saying goes, Mr. Speaker, I think where you stand depends on where you sit. And as I said earlier, the windfall came from the resolution of a dispute related to the offshore royalties. We know the award is expected to be in the range of $250 million, but beyond that, little information has been provided as to the nature of the contents of this settlement. So, despite many requests outside of this chamber, the Premier has declined to offer any additional detail. Will the Premier please provide this House with additional detail on the royalty settlement and allow members to reach their own conclusions regarding the province's success in this arbitration?
The Honourable Premier.
Madam Speaker, she stands in opposition of everything, and we stand with Nova Scotians, Mr. Speaker. The reality of it is, if she goes back to the offshore agreement that was negotiated, Mr. Speaker, decades ago, there was a provision, an arbitration provision in that when the two parties, if they had disputes, that would go to the arbitrator, who would then work their way through this. This has been an ongoing process. An independent arbitrator picked long ago when the agreement was signed, ruled on behalf of the people of Nova Scotia. She should celebrate the fact that the good public servants have worked very hard through successive governments. She should celebrate the fact that we've listened to the high-speed internet conversation. We listened to their call for more money for doctors, Mr. Speaker. We're really listening in this House. It's amazing how well we work together.
The Honourable Leader of the Official Opposition.
I want to thank the Premier for his answer. To be honest, I've never been accused of not listening. So the Westminster system is designed to be an adversarial system where our leaders are subject to examination of the people and their representatives, where our government's actions can and must be subject to scrutiny in the interest of the public good. To say this information cannot be shared is not keeping within the spirit of our system. Surely, the confidentiality and the privilege associated with this particular settlement can be extended to capture the Auditor General, perhaps. So will the Premier refer this settlement to the Auditor General to offer a higher level opinion on this settlement?
The Honourable Premier.
Mr. Speaker, I want to thank the Honourable Member for her question, and she's very right. Our system and governments are there to be judged. Quite frankly, Nova Scotians have judged our government, Mr. Speaker. Young people have judged our government by staying here in record numbers. Mr. Speaker, when we look at the credit rating agencies, they've judged our government by continuing to increase the credit rating in this province while they're downgrading credit ratings in every other jurisdictions in this country, Mr. Speaker. People around the world have judged this government in this province by coming here in record numbers, Mr. Speaker. Our tourism agencies, Mr. Speaker, have had record year, and I am looking forward to the new numbers that are coming out in the very near future, Mr. Mr. Speaker, to build on the great work. We are being judged each and every day, Mr. Speaker, and what we're seeing is people have confidence in this government.
The Honourable Leader of the New Democratic Party.
Thank you, Mr. Speaker. Mr. Speaker, over the course of the last 5 years, long-term care patients have occupied 718,230 hospital bed days in our health care system. Here is another fact. The cost of those bed days to the province over that period has been more than $933 million. Mr. Speaker, how can the Premier justify not opening a single nursing home bed in this budget when his failure to invest in long-term care has cost our province over this period just short of $1 billion?
The Honourable Premier.
Thank you, Mr. Speaker. Again, I want to remind the Honourable Member when we came into government following his party being in power, Mr. Speaker, we reduced the long-term care wait list by over 50%, providing more options to Nova Scotia families. We've heard very clear from seniors, Mr. Speaker, people in this province who want to be at home, being cared for by their loved one as long as they absolutely can. It's why we continue to invest, Mr. Speaker, in the caregiver allowance program, which is working with families, home care, which has been a substantial increase in every one of our governments. But again, I want to go back to the numbers that the Honourable Member is using. He's not accurate. Not all of those people, Mr. Speaker, are waiting for long-term care. Some of those people are in palliative care, Mr. Speaker. There were a number of reasons why they were there. They were trying to transition to home. We needed to put in place supports for them to be able to transition to home. These are important factors that he's leaving out when he takes the numbers and cherry picks to make his argument. The fact of the matter is we continue to reduce the number of people waiting on long-term care lists, and we'll continue to look at the alternative. And if the requirement for more beds, Mr. Speaker, it will become part of our capital plan.
The Honourable Leader of the New Democratic Party.
Mr. Speaker, what the Premier has said about inaccuracy and cherry-picking numbers is not the case. These are not my numbers. They are not the NDP's numbers. They are the numbers of the Canadian Institute for Health Information. Mr. Speaker, if every person waiting in a hospital bed for a nursing home placement over the last 5 years in Nova Scotia had gone directly to a long-term care facility, the province would have saved $750 million. Mr. Speaker, when the Premier took office 5 years ago, he inherited a plan to open over 300 new nursing home beds. This would have taken all kinds of pressure off our health care system. It would have saved us millions. Can the Premier explain why it is that he did not act on this plan to open new nursing home beds, which was sitting on his desk when he came to office?
The Honourable Premier.
Mr. Speaker, I want to thank the Honourable Member for the question, Mr. Speaker. One of the challenges, Mr. Speaker, when we came into government, we had a $500 million hole, Mr. Speaker, that we had to deal with because the Honourable Member and his party wouldn't represent all Nova Scotians when it came to the bargaining table. He gave a 7.5% raise across the public sector, which is $700 million cost of delivering services into the people of this province, Mr. Speaker. The fact of the matter is, Mr. Speaker, every credit agency, when they saw that government continue to look at this province in a negative way, private sector people were leaving, population was going down, young people were looking for hope elsewhere. The reality is, Mr. Speaker, you need to strike a balance. You need to ensure that we provide opportunity for young people to grow the economy, to provide governments with more money to be able to invest in the very things that he's talking about. But he should listen to actual Nova Scotians who say, I would like to be home as long as humanly possible in my home. It's why we invested in home care, Mr. Speaker. It's why he should listen to families who say, when I care for a loved one, I should be treated appropriately. That's why we've expanded the caregiver's allowance. This is striking the right balance to ensure that we can live within our fiscal means.
The Honourable Member. Honourable Leader of the New Democratic Party.
Mr. Speaker, the Premier has demonstrated how fond he is of attempting to control a conversation, but there is something that the Premier nor this government can control, and that is the fact that none of us is going to get any younger. Mr. Speaker, people in Nova Scotia are going to need nursing homes, whether the government likes that or not. So I want to ask the Premier, Mr. Speaker, why can't he see that by not opening a single new nursing home bed in our province, all he's doing is putting off and deferring inevitable necessary spending and putting us in a place where we're going to have to make massive expenditures down the road?
The Honourable Premier.
Mr. Speaker, he's going back in a time, Mr. Speaker, when the Democratic Party were governing this province. No one is ignoring the issues facing this province today, Mr. Speaker. This government has responded to the needs across this province. I want to remind the honourable member, in every budget, we've invested in home care. More Nova Scotians tell us they want to stay home as long as possible. We've heard from families who said to us, we want to care for our loved ones. We've invested, Mr. Speaker. If I had followed the recipe that the Democratic Party had left on the Premier's desk, this province would be in a hole, Mr. Speaker, unrecoverable. Our children will be looking for hope somewhere else. The reality of it is not only are our children seeing a future here, the young people from around the world are seeing a future here. At the same time, Mr. Speaker, we're striking the right balance of providing care to those individuals, providing quality education to our citizens, ensuring vulnerable Nova Scotians get looked after, and by the way, creating an economy that the rest of Canada is island.
The Honourable Leader of the Official Opposition.
How much time do I have? Look, Mr. Speaker, all members in this chamber, and in particularly the members of Pictou County and Cape Breton, have watched access to mental health care decline under this government. It's a simple fact. Everyone's aware. Everyone's aware that the Aberdeen unit was closed for mental health, and the overworked remaining psychiatrists left. When we raise these questions here on the floor, though, it's the same answer. The Premier thanks a number of people and then announces some fancy-sounding programs, like the Practice Ready Physician Stream. My question to the Premier is, if this programming is the answer to the government's plan to alleviate suffering and wait lists for physicians, why did he re-announce it in this year's budget but allocate no new money for it?
The Honourable Premier.
Great question, Mr. Speaker. I want to thank. It's part of the plan, Mr. Speaker, working with our partners. If you would follow when we talked, we require the Dalhousie Medical School to implement that program, Mr. Speaker. She would know that we've created funding that's been available, that the money would be there. She would know it's taken us long to take. No, that's actually not accurate. So whoever your reasoner is should look that up. Don't listen to the former minister.
Order, please.
Listen to the current.
I'd like to remind the Honourable Premier not to address members directly. The Honourable Premier.
Thank you, Mr. Chair. I appreciate the advice. But I want to remind the honourable member that that program we rolled out with the Housing Medical School, and it's adding to the other programs that we're doing with them, and we're looking forward to ensuring that those physicians who choose to come to this province and need some requirements for practical readiness will have that opportunity in our province.
The Honourable Leader of the Official Opposition.
Well, Mr. Speaker, the public perspective out there is that the trend under successive budgets from this government is to basically announce, underspend, and then re-announce. In no area is that more cruel, though, than support for mental health services. And 2 days ago, 2 parents laid their hearts out on the floor in this foyer below after losing their 2 sons to suicide. So where in this budget of re-announced funding is the money for suicide prevention in Nova Scotia? Because obviously a 1-800 number is not acceptable anymore.
The Honourable Premier.
First of all, Mr. Speaker, to the family who came here to continue to have their personal language as part of them and to continue to share that with us, to continue to make sure that we stay focused and committed to providing services to families who trouble. We are all indebted to those Nova Scotians who continue to show us, Mr. Speaker, the challenge. I want to tell the honourable members I did yesterday the increase that we've made in investments in around adolescent mental health, the issues that I believe will be part of the report that will be coming in around the inclusive school environment, which will provide a wraparound support, providing supports to those families, are all part of this budget. We now spend $300 million on mental health. Today, the current budget that is before this House to be debated will increase that by almost $90 million, Mr. Speaker. That's a substantial increase over a period of time. We're continuing to work with those partners to try best practices. Dr. Stan Kuchar has worked with us when we were in Cape Breton to provide some strategies. We're continuing to make those. But again, I want to end with how I started. Mr. Speaker, we are all indebted to those Nova Scotians who continue to remind us the importance of making investments into these programs.
The Honourable Member for Cape Breton Centre.
Mr. Speaker, my question is for the Minister of Health and Wellness. At 3 o'clock this morning, when I couldn't sleep, there were no available ambulances on Cape Breton Island. 3 o'clock this morning, not one. Yet yesterday, the Minister of Finance, though, told this House that the province would be investing in EHS to ensure that more ambulances are available. However, upon further scrutiny, it appears that this new investment is, in fact, just simply the government meeting its contractual obligation to our paramedics to deal with increased call volume. So not new money, it was part of their contract. So, Mr. Speaker, does this minister think that his department deserves to be celebrated for actually adhering to a collective agreement?
The Honourable Minister of Health.
Thank you, Mr. Speaker. Thank the member for the question. Indeed, Mr. Speaker, as has been discussed already, the budget process and being transparent, acknowledging where new money is being spent, Mr. Speaker. This is new money going forward to meet the increased call demand of our EHS system, Mr. Speaker. That's exactly what the Minister of Finance said yesterday, is that this new money was being made available to the service provider of our EHS system.
The Honourable Member for Cape Breton Centre.
Mr. Speaker, a few weeks ago we heard reports of nearly 20 ambulances backed up for hours outside both the Halifax Infirmary and the Dartmouth General Hospital. We know that the paramedics are struggling to transfer these patients into the care of the hospital because there just isn't space. More ambulances won't help when the paramedics are waiting in the hospital hallways for 12 hours at a time. We can put on 100 more ambulances. It's not going to move the flow of patients. Mr. Speaker, anyone working in the system will tell you that the shortage of nursing home spaces is paralyzing our major hospitals. Just ask any of the staff. My question is, why has this minister refused to invest in long-term care beds?
The Honourable Minister of Health.
Thank you, Mr. Speaker. Thank the member for drawing the House's attention to the needs of Nova Scotians, particularly our ageing population, for continuing care services and support. Mr. Speaker, as I've mentioned many times before, we've listened to Nova Scotians. We know that the preference for our ageing population is to continue to receive care in their community, in their homes, for as long as they can. That's why in each of our budgets, Mr. Speaker, we continue to invest and expand our investment for home care services and programs, Mr. Speaker. We've essentially eliminated wait lists in much of the province around home care, Mr. Speaker, and we've reduced the long-term care wait list by over 50%, Mr. Speaker, since coming to office. So we listen to the requirements, Mr. Speaker, the needs of the Nova Scotians, and we work to achieve and move forward. Thank you.
The Honourable Member for Cumberland North.
Mr. Speaker, on the same note, last Monday, 17 ambulances waited for hours at a local Halifax hospital. Many of them waited with their patients up to 10 hours before they were able to offload their patients to the Emerge department. Last month, the Minister of Health did tell us here in this House he was going to ask for a report with recommendations on how to solve this unacceptable wait time. Could the Minister of Health please update those of us here in the House when he expects this report?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I thank the member for the question. As the member has an extensive background herself in the healthcare profession, I think she would recognize and appreciate the complexities of addressing complex challenges like this. So the work is underway. Staff are working diligently to bring forward some recommendations, Mr. Speaker. And for me, my goal is to get appropriate recommendations to move forward with when those recommendations come forward to me. But I haven't yet received that report.
The Honourable Member for Cumberland North.
I thank the Minister for his answer, and I think it's important that this is an urgent matter and that we need to be putting pressure on those that are developing this report and recommendations so that immediate action can be taken. Paramedics are highly skilled, and they have a target of trying to reach people within 9 minutes of someone calling 911. 9 minutes. They cannot achieve this, Mr. Speaker, with the current situation. So again, I would like to ask the Minister of Health, can you please make this an urgent matter? And based on making it urgent, when is the earliest he could provide this House with a report and recommendations on this urgent situation?
The Honourable Minister of Health.
Thank you, Mr. Speaker. Again, I thank the member's concern and interest in this very important area. Mr. Speaker, I can assure the member opposite and all members of the legislature that, indeed, not just for myself or for this government, but for the public servants and the professionals that work in our healthcare system, that addressing these concerns is a priority already. They recognize the importance of addressing and moving forward in these areas. That's why, Mr. Speaker, and we also recognize the complexity that there is no single silver bullet, Mr. Speaker. That's why we recognize part of the solution is multifaceted. We see our investments in primary health care, Mr. Speaker. We know some of the pressure in our emergency rooms relates to people that are showing up at emergency rooms because they don't have primary care access. We've seen significant investments to improve primary care. So we're already moving on initiatives that we believe will help address part of the concerns, Mr. Speaker, while waiting for the report to come forward.
The honourable member for Northside, Westmount.
Thank you, Mr. Speaker. Mr. Speaker, my question is to the Minister of Health. Monday, I read with great interest an op-ed piece in the Cape Breton Post from the Minister of Municipal Affairs. It included some staggering statistics on the state of family physicians in the Sydney area. According to the Minister, 1,900 people in the Sydney area have been removed from the Need of Family Practice Registry, leaving only 83 people from that area in need of a family practice, a doctor. 83, Mr. Speaker. The Minister of Municipal Affairs went on to state that there were more than a dozen additional healthcare workers on their way. Mr. Speaker, in my books, and anyone's keeping track, that's one healthcare worker for every 6 people. My question to the Minister is, for the Minister of Health, does he stand behind the numbers stated by his colleague that only 83 people in the Sydney area need a family doctor?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I appreciate the member bringing attention to this. I believe the data brought forward, based upon the latest data we have from the 811 Need a Family Practice Registry, that is consistent with the data that we have, Mr. Speaker. That just goes to show, again, the tremendous work and the value for Nova Scotians when they do register, that as family practices are available to take on new patients. And I think that, again, Mr. Speaker, with the investments that we've recently announced to encourage existing family practices to take on more patients directly from the 811 list, to provide incentives, both through the remuneration on a salary basis for the fees, but also, Mr. Speaker, through one-time registration fees. We're taking a multifaceted approach, working with our physicians and primary care providers to move forward, and this just demonstrates some of that value. Thank you.
The honourable member for Northside, Westmount.
Thank you, Mr. Speaker. Mr. Speaker, sounds to me, if those numbers are correct, then I don't know why we're bringing in more people. They're saying we have enough now in Cape Breton Island. According to the people that come to my office, that's not actually the case. And if this Minister and the Minister of Health know that this need is greater than 83, why would they use that number? Mr. Speaker, the healthcare crisis in this province is real. The healthcare crisis in Cape Breton is real. The Premier, the Minister of Health, and everybody who lives in Cape Breton knows this is real. So if we're going to deal with real problems, can we deal with real numbers? Mr. Speaker, my question to the Minister is, will the Minister of Health please tell the House what numbers he's using to assess these family practice needs in the Sydney area?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I just want to clarify in the member's preamble there made reference to 2 different types of data, Mr. Speaker. He's talked about Sydney and talked about Cape Breton, Mr. Speaker. I don't live on Cape Breton Island, but I live right next door, Mr. Speaker, and I know Richmond and Inverness are part of Cape Breton, so I just want to clarify if the member's talking about Sydney or Cape Breton Island when he's talking about Cape Breton. So, Mr. Speaker, within that context, as I said before, the data that the member brought forward was from the 811 registry list information that we have, specifically referencing Sydney, Mr. Speaker, is my understanding of the data that's being referenced here. So that's what was being spoken about there. In terms of the resources, as the member, when he asked the question, Mr. Speaker, brought forward, was the additional doctors and healthcare professionals going to Cape Breton. That would be the entire region of Cape Breton Island, Mr. Speaker, in the Eastern Zone. Thank you.
The honourable member for Kings North.
Mr. Speaker, my question is for the Minister of Health. Mr. Speaker, our office has been in contact with the Schizophrenia Society regarding yesterday's provincial budget. If there is good news in the budget for Schizophrenia Society, is that their funding from the Department of Health wasn't reduced. The bad news, of course, is it remains at absolutely zero. The Schizophrenia Society provides important support for individuals suffering from schizophrenia and for their families as well. They work to provide supportive housing and accept referrals for acute care. Mr. Speaker, my question for the Minister is, how can the department claim to be making investments in the treatment of mental health when an organization as dedicated as the Schizophrenia Society is left out in the cold?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I think the member may appreciate that I too have a very direct and personal interest in the work of the Schizophrenia Society, Mr. Speaker. Recognize the value of the work that they do with families and individuals who are suffering from and diagnosed with schizophrenia, Mr. Speaker. We do recognize that importance, but Mr. Speaker, what I want to clarify for the member opposite is that not all organizations that receive funding are recognized on a line-by-line item. We have several programs, grant-based programs and supports that do support our community partners, like the Schizophrenia Society, Mr. Speaker. I believe they received significant funding last year for some programs they're working on. We'll continue to work with them to ensure that they can continue the good service that they provide across Nova Scotia.
The Honourable Member for Kings North.
Mr. Speaker, I'd like to thank the Minister for that answer. In fact, we know this government has made significant cuts to the Schizophrenia Society in the past. Mr. Speaker, the Schizophrenia Society is an enormous supporter of those with mental health concerns and substance addictions. They support 4,500 people a year and receive more than 1,000 additional calls from those seeking assistance. They are reaching a lot of people already, but are hoping and willing to do more. They receive about $40,000 from community services, but it pales in comparison to the needs they face. Mr. Speaker, if the Minister of Health is going to continue to rely on community organizations like the Schizophrenia Society to provide mental health supports, shouldn't he at least chip in and help Schizophrenia Society?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I thank the member again for not just bringing forward the question around mental health. We all know, I believe, on all sides of the legislature, for all parties, Mr. Speaker, the interests and the concerns. I can't imagine that a single one of the members in this legislature does not know someone who has been afflicted by mental health diagnoses or its impacts, Mr. Speaker. As I'd said in my first response, Mr. Speaker, we do work with our community partners, including the Schizophrenia Society. We have a number of avenues where financial supports are provided, including our numerous grants programs, Mr. Speaker, either through the department and also through our health authorities as well that have grants and supports that are available. And as I said, I've met with and they meet with staff on a regular basis. If they need help seeing where programs that they can apply to, they know they just have to reach out and we'll work with them.
The Honourable Member for Dartmouth South.
Mr. Speaker, my question is for the Minister of Justice. On the International Day for the Elimination of Racial Discrimination, hold your applause, please. I'd like to ask the Minister about street checks. We know police street checks disproportionately criminalize Black Nova Scotians. As Sergeant Robin Atwell recently said, echoing many others, this practice is wrong, it's not effective, we should end it. And I'll table that. Given the known harm associated with street checks, there is no reason the practice should continue while we wait for the conclusion of the Human Rights Commission. We know harm is being done and the government is letting it continue. And I'll table that. It's a troubling message. Will the Minister explain why he won't put a moratorium on street checks now, pending the outcome of the Human Rights Commission?
The Honourable Minister of Justice.
Thank you, Mr. Speaker, and I do want to acknowledge and recognize how important it is that police interaction with the public at large is a priority and important to each and every one of us. The work that Dr. Wortley is doing will help inform our decisions, Mr. Speaker. I've spoken in this legislature before about evidence-based decisions. I will continue with that practice. This particular issue has been brought front and center. It has to be addressed, and we value the work and look forward to the outcomes that Dr. Wortley will provide us. Thank you, Mr. Speaker.
The Honourable Member for Dartmouth South.
Mr. Speaker, this isn't about interactions, it's about data collection. And with respect, whose evidence are we listening to? Because we have an abundance of evidence from our most vulnerable communities that this practice is wrong. And it's frustrating, Mr. Speaker, to hear data collection as justification for systemic racism. It makes me especially sad that this government is so keen on collecting data in a way that marginalizes African Nova Scotians, because I know that in contrast, it drags its feet on collecting data that could help bring justice for the same communities. For instance, we know that Indigenous and racialized people are overrepresented in the provincial prison system. We suspect that they are overrepresented in solitary confinement, but we can't say for sure because the department still does not collect that data. In 2016, in response to our questioning, the Minister of Justice at the time made a commitment to provide us demographic data by 2017, and I'll table that. We have yet to see it. Will the minister table for this House the demographic statistics for Nova Scotians placed in solitary confinement?
The Honourable Minister of Justice.
Thank you, Mr. Speaker. And my colleague, the Minister responsible for African Nova Scotia Affairs, spoke earlier today eloquently, Mr. Speaker, about the priority in addressing systemic racism. We have undertaken, Mr. Speaker, a number of issues to address the systemic racism that has taken place across the province. We have implemented strategies, Mr. Speaker, within our public service, within corrections facilities, across multiple government departments, Mr. Speaker, about a journey that we all have to take, using his words, together, Mr. Speaker. We will continue that work. I've invited my colleague to the correctional facility. She participated in a tour there, Mr. Speaker. She saw firsthand the circumstances that exist in that community, Mr. Speaker. We will continue to work towards solutions in each of these areas.
The Honourable Member for Queens-Shelburne.
Thank you, Mr. Speaker. Mr. Speaker, my question is for the Minister of Health and Wellness, and I welcome his applause, if so. An 84-year-old senior was experiencing severe breathing issues. Fortunately for her, she was able to be transported by ambulance to the Scotia Regional Hospital, where an emergency room physician treated her for pneumonia and congestive heart failure. However, her medical condition was not the only problem she would face. Instead of being admitted to a hospital room with a bed, she was left lay on a gurney in an emergency exam room for an unbelievable 5 days, not a reflection of the healthcare professionals. The gurney had to be shoved against the wall to ensure she didn't fall out of bed. But it gets worse, Mr. Speaker. She had to share this small space with another individual. When medical professionals did their observation of the second patient, they had to wear a mask and take other precautionary measures to protect themselves. My question to the Minister is, how is this infection control, and is this the kind of indignity that people should become accustomed to when being admitted to hospital due to the lack of available beds in our local hospitals?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I thank the member for the question. Of course, Mr. Speaker, that's not a scenario any of us would endeavour to want our hospital system to be operating towards. But, Mr. Speaker, what we do know, and there's been a lot of public recognition of this fact, that we did have a higher, more intense impact of the flu season this year, Mr. Speaker, which did increase the pressures on our hospital systems, Mr. Speaker, especially amongst vulnerable populations. That is, those populations more vulnerable to the flu this year. The flu vaccine wasn't as effective in this season, but again, Mr. Speaker, we continue to work, as the member mentioned, to the healthcare professionals do work with the standards for their training. They can put together a program to treat all patients that come through those doors.
The Honourable Member for Queens-Shelburne.
Sadly, Mr. Speaker, for this lady, she was too sick to be home and too sick to be in hospital under conditions that she was placed in. If the story only ended here, it would be bad enough, but the indecencies only continue. Days sharing an exam room with another contagious patient, unprotected, wasn't the only exposure to this elderly woman. To add insult to injury, the only washroom facility available was an emergency room, public washroom, down a long corridor where this elderly patient was required to walk in a Johnny shirt. This lady deserved better, and Nova Scotians expect better. Is this what the Minister means by quality health care for Nova Scotians?
The Honourable Minister of Health.
Thank you, Mr. Speaker. And as the member would know, we recognize the need to put a priority on our health care system, Mr. Speaker. That's why it's received significant investments in the budget we brought forward, Mr. Speaker. We know that much of the pressure and concerns of Nova Scotians have been around primary care access. That's been a priority for us, Mr. Speaker. We've made significant investments there to improve access, both through collaborative care practices, which provides an opportunity to bring together a variety of primary care, healthcare providers, nurses, as well as physicians and others, Mr. Speaker. And in addition to that, Mr. Speaker, we continued with major investments to support our family physicians, because we know they are critical team members as part of these collaborative practices in our communities, to encourage them to take on more patients across Nova Scotia, but it'll also work to enhance both recruitment and retention of these physicians to provide more care to more Nova Scotians.
The honourable member for Sydney River-Mira-Louisbourg.
Thank you very much, Mr. Speaker. And Mr. Speaker, my question through you is for the Minister of Health. Mr. Speaker, yesterday my colleague from Cape Breton Centre identified the number of closures of emergency rooms in Cape Breton Island. Cape Breton Regional Hospital, Mr. Speaker, has 33 beds in its emergency department. On March the 19th at 3:30 in the afternoon, 27, Mr. Speaker, of those beds were tied up with admitted patients with no beds to go to, because the beds were tied up with people who should be going to long-term care. Mr. Speaker, they were waiting for placement in other areas of the hospital, and as a result, there were only 6 beds available in the emergency department to look after the overflowing crowd of individuals that needed help. Mr. Speaker, does the minister still stand by his statement that there is no crisis in health care in Nova Scotia?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I thank the member. I think, as the member recognized, again, the demands on emergency rooms throughout the province this winter was higher than normal, based upon a more aggressive flu season this year, Mr. Speaker. So we did see more people presenting. But we also recognize, Mr. Speaker, that again, as that situation would also afford response to that, having stronger, more access to primary care access, Mr. Speaker, would be an important way to reduce the pressures on our emergency rooms. That's why we continue to invest in and expand collaborative care practices, bring together healthcare providers to support Nova Scotians, as well as recent announcement of significant investment to our family physicians and family practices to provide more care to more Nova Scotians when they need it.
The honourable member for Sydney River-Mira-Louisbourg.
Well, Mr. Speaker, what I do recognize is that this minister has no compassion for the individuals that need health care today.
Order,
I could
please.
be a lot cruder.
Order, please. Order, please. I'm just going to ask the honourable member to retract that. I'm going to take that as a personal shot at the opposite member. The honourable member for Sydney River-Mira-Louisbourg.
I will retract that statement, Mr. Speaker, in respect for you. Mr. Speaker, yesterday the minister rightly observed that we have top-notch medical professionals working hard in our province, and we all agree with that. Unfortunately, Mr. Speaker, they are working in a broken system. It's a system that isn't serving Nova Scotians well. So my question to the minister is, will the minister explain for the patients who sat in the Cape Breton Regional Hospital's ER for hours on end how well his integrated healthcare system is working?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I thank the member for raising the question. I believe he made reference to what he referred to as a broken system, Mr. Speaker. I would like to suggest the member reflect back to a few months ago, month and a half ago, when we were in Cape Breton and Sydney at a public forum that was hosted there. There was a panelist of 3 individuals, 2 physicians, and a former head of the Cape Breton Regional Health Authority, Mr. Speaker. And if the member reflects back at that, and this was a comment that was reflected at the other public forums hosted in Halifax as well as down in Yarmouth, Mr. Speaker, that made reference to the fact that the challenges facing our healthcare system today did not start yesterday, Mr. Speaker. They started decades ago, Mr. Speaker, and successive governments failed to act and take action to resolve these issues, Mr. Speaker. This is a government that has taken the initiative to focus on our primary care, Mr. Speaker, work with our healthcare professionals, and move the system forward.
Order, please. Order, please. I'm really hoping the honourable member for Colchester Muscatavit Valley has a question. The honourable member for Cole Harbour Eastern Passage.
Thank you, Mr. Speaker. My question is for the Minister of Community Services. I had a call last night from an amazing constituent of mine who agreed to take her older brother into her home when he was failing in a small options home close to home. He's blind, he has intellectual disabilities and behavioural problems. Under the Family Support Program, she was given just under $1,000 to cover rent, food and other expenses. But she was working 3 jobs on her own and his expenses outpaced what she could keep up with. So she went to Community Services looking for help. She asked them and they said the only thing they could do was to move him into the independent living program, so he had to move out. He's now getting more money for his rent, more money for his food. He has VON coming in every day and a CCA. So his expenses for our government now are approximately $4,000. So my question to the minister is, has she looked at options where family members can be the paid care provider at a lower cost than what we're paying the healthcare system and the Community Services Commission? Thanks.
The honourable member, Minister for Community Services.
I want to thank the honourable member for the question. Yes, there are programs that do provide support to families to look after family members, but in any individual case, I'm happy to sit down with the honourable member and take a look at what the options are that would in fact support this individual to be able to live with his family without having him to move out. Thank you.
The honourable member for Cole Harbour Eastern Passage.
Thank you, Mr. Speaker, and thank the minister for her answer. Since moving into his own apartment, this gentleman has had a number of falls, and each time he falls, it's harder for him to get back up again. I am told that his caregivers don't show up 10 to 20% of the time, and he's going to give me the documents to support that on Saturday. He goes days without having his home cleaned. He's gone a month without having his bed changed. He's legally blind, and they've left things on the floor that he's repeatedly tripped over, left the stove on. They've made calls constantly to the department that's looking after him in terms of the company. Mr. Speaker, my question to the minister is, we want to keep people in their home, but when it's not safe for them to do so, can the minister look at providing family members with the ability to be the paid care providers? Thank you.
The Honourable Minister for Community Services.
Thank you. I want to thank the honourable member for the question. We do have money available for that. It's about $400 a month, as I recall, so that they can do that. I recognize that that does not replace a salary, but in any case where the honourable member has a concern about the care that any of our folks that we support are receiving, I invite her to reach out to me, and we'll be happy to sit down there. We also have a new program where we are linking up families with care providers to make sure that they get because sometimes it can be difficult to access appropriate people to look after folks. So we do have new money for that in this budget as well. Thank you.
The honourable member for Dartmouth North.
Mr. Speaker, yesterday I was pleased to see the Minister of Community Services take action on the clawback of child support payments after our caucus raised this concern about this issue last fall. This is a simple change that will put an average of $2,000 annually per child back in the pockets of single parents receiving income assistance. Wait for it. Unfortunately, parents will have to wait until August for this change to take effect. So, Mr. Speaker, my question is for the Minister of Community Services. Why do these families have to wait another 5 months for the clawback of their child support payments to end?
The Honourable Minister for Community Services.
I want to thank the honourable member for the question, and I do share her impatience waiting to see this new program come into effect, but it does take some time to work through the process, to train people, etc., and we feel that August is when we'll be able to be ready to launch that successfully. Thank you.
The honourable member for Dartmouth North.
Mr. Speaker, other child-related amounts, like the child benefit, Canada Child Benefit, have not been deducted from income assistance payments. So I don't see how it would take 5 months for this particular change to come into effect. We have often heard the Premier speak about his commitment to strengthening maintenance enforcement to collect the millions owed to children, and he has called the practice of clawing back child support unfair. It seems doubly unfair for the government to know this and to continue to take millions of dollars from children in need. Mr. Speaker, my question is, will the minister agree to make this change retroactive to the time when her department became aware of this unfair practice?
The Honourable Minister of Community Services.
I want to thank the honourable member for the question, and I would note that when the Canada Child Benefit came into effect, it did not come in at the beginning of a budget year. It came in partway through the year, and we're doing the best we can. We will have it ready when we are able to, and we are very pleased to be able to roll out the significant improvement in the lives of Nova Scotian families. We want young Nova Scotians to be able to grow and succeed here, and that's exactly what we're doing. Thank you.
The honourable member for Cumberland North.
Mr. Speaker, I was disappointed yesterday to see in the provincial budget a windfall of over $9 million net profit, mostly off the backs of business owners, commercial truckers, and citizens of Cumberland County. Mr. Speaker, 20 years ago, the Cobequid Pass put tolls in, and the government of the day promised the people of Nova Scotia, and particularly Cumberland County, that those tolls would be removed once the debt was paid. Under the leadership of PC leader John Ham, the debt was scheduled to be paid off in 2018. I'd like to ask the Minister of Transportation Infrastructure Renewal today, will he live up to the promise given 22 years ago in 1996 to remove the tolls from the Cobequid Pass?
The Honourable Minister of Transportation.
Thank you, Mr. Speaker. It gives me great pleasure to stand and talk about the Cobequid Pass and the tremendous success that has been as an example of a P3 project for all Nova Scotians. This provincial government is committed to taking the tolls off the Cobequid Pass for Nova Scotian motorists once the bonds are paid off, which we are hoping to see in the next 12 to 24 months. Thank you.
The honourable member for Cumberland North.
Well, that is great to hear. I would like to have the minister just confirm, when I'm done here, that the tolls will be removed completely for all drivers, including commercial trucks, including commercial truck owners in Cumberland County. And another issue I would like him to address is the Wentworth Valley. When the tolls were put in, the speed limit was artificially lowered by 30 kilometers an hour. Trucks are not allowed, they're prohibited from going through there. They must go over the pass to pay those tolls. When the bonds are paid off, will the minister also do a speed study and restore the safety, the best speed safety for the Wentworth Valley, so the people of there are not penalized, Mr. Speaker? Thank you.
The Honourable Minister of Transportation.
Thank you very much, Mr. Speaker. And I want to tell the House and tell the people of Nova Scotia how pleased I am that this particular piece of infrastructure has saved over 40 lives, Mr. Speaker, in the history of this facility. It has reduced the fatality incidents by over 2 fatalities per year for a consistent 20 years. And that's what the Highway Twinning Program is about. It is to make Nova Scotians' safety, it's taking Nova Scotia's safety as a #1 priority. Mr. Speaker, I'd like to table the CAA driving costs, which clearly illustrates that the cost of the toll for commercial and residential drivers in taking the Cobequid Pass represents a saving for those people who take it because of time and distance.
The honourable member for Pictou East.
Thank you, Mr. Speaker. My question is for the Minister of Transportation. The junction of the Abercrombie Road and the Trenton Connector is a dangerous intersection and the scene of many accidents, sadly many of them fatal. Residents traveling down the road towards the connector have a posted speed limit of 100. It drops to 80 just before coming to the level junction at the Abercrombie Road. The high speeds approaching are sometimes part of the issue as well. So local concerns are mounting for the safety of this intersection. People in the community would be keenly interested in any additional measures that could improve the safety of the intersection, whether it's improved signage, changes to the speed limit, changes to the length of the light, whatever it might be. Any of these measures would greatly improve the safety and alleviate some concern. My question for the Minister is the Minister aware of any study or any options that could be considered to improve the safety of this intersection?
The Honourable Minister of Transportation.
Thank you, Mr. Speaker. And I can assure the member opposite that all 2,200 employees of the Department of Transportation and Infrastructure Renewal are keenly interested in safety as the primary fundamental part of their work. When they go to work every day, it's all about safety. And as a department, that's what we're concerned about. And I appreciate the member bringing that matter forward at this particular intersection. It is a signalized intersection, Mr. Speaker. There's a significant amount of industrial traffic there, which is accentuates the importance of it. Recently, the signals were inspected and found to be in top working order.
The Honourable Member for Pictou East.
Thank you. Would the Minister consider putting the intersection on the list for a roundabout?
The Honourable Minister of Transportation.
Thank you, Mr. Speaker. Last fall, we did brush cutting at that intersection. We put new signage in, and we will consider looking at that for future improvements. Thank you.
Thank you very much. That concludes the time allotted for oral questions put by members to ministers.